paano i-compute ang Carbonen formula sa target heart rate calculation 5 times. O references is from O'Sullivan, okay? So most of my topics are from O'Sullivan gid. So there ako nagkuha sang interventions for your cardiac rehabilitation. Same with your peripheral vascular diseases. So hindi ko daan confident guys no sa ako ni example kagina for the Carbonen formula. So nangita na lang ako sa video so that you can see no base man sa iya nga nakuha sa iya nga self. Okay, so ma-watch lang ta video for that. So please tell me no kung ano siya. Kung makita niyo, wait lang. And if you can hear it. So can you see it guys?
Yes, miss.
Yes.
Okay, sige. Tell me kung makabatian nyo ha. Okay, can you hear it?
Wala.
Okay.
Wala.
Wala. Sige, wait lang ha. Try ko ako nga. Okay, wait lang.
Formula to calculate target heart rate.
How about that one? Bation siya?
Yes, miss.
Okay, sige. Start ko ha.
Hi and welcome back to Physio Tutors. The Carbonen formula is a simple formula that you can use to calculate the target heart rate during exercise. The target heart rate is a percentage of an individual's maximal heart rate. The Center of Disease Control defines 50 to 70% of the maximal heart rate as moderate intensity, and everything above 70% is characterized as vigorous intensity. To calculate the target heart rate, you will need the resting heart rate and the age of the individual. The resting heart rate is ideally measured upon waking up in the morning. Alternatively, have the patient lie down for 30 minutes, breathing in a relaxed way and not talking, then take the pulse. In order to be able to calculate the target heart rate using the Carbonen formula, we need several components. First, we need the maximal heart rate, which is calculated by subtracting the age of the individual from 220. So, maximum heart rate is 220 minus age. So in my case, that would be 220 minus 24, and that equals 196. Second of all, we need the resting heart rate. I use an activity tracker and it gives me a resting heart rate of 45. Second of all, we need an intensity that we want the individual to work at. So in our case, we're just going to use 60%. Okay, now that we have these components, the formula goes as follows. Take the maximum heart rate for your individual and subtract the resting heart rate. Then you're going to multiply that by the intensity that you have chosen. In our case, that's 60%. And add the resting heart rate, which is 45, which is going to give you a target heart rate of 135 beats per minute. Alright, if you like this video, be sure to also check out our
Okay, so, abot na siya guys, no? So, when you try to get the target heart rate, dapat may exact kagid. So, hindi siya dapat range. Dapat you have an exact percentage of the heart rate that you need to, to get. So, usually, ikaw na, as the PT would, yes, pwede send ko later. Actually, include ko siya sa may, sa may folder nyo, sa may, folder sa Schoology. Okay? So, karon i-post ko na siya after this, our second session. Wait, magid guys ha. Na-allergies ako. Alright, so any question so far sa first session? Para karon hindi man tumpok-tumpok ang questions. So far none pa man, clear man ang tanan. So far clear pa man guys.
Yes.
Hindi pa man ganyan niya. Yes, pwede siya as a self-monitoring, no, ang imo talk test. So, pwede siya actually, it's a way, your talk test is a way to know if ang intensity ni patient is kaya niya pa or hindi siya over sa iyang capacity to perform exercises at that moment. Okay? So, hindi siya actually intensity indicator. Your talk test is actually a monitoring technique. So, para ma-monitor mo if kaya niya pa i-perform ang exercises while talking. So, that's for your talk test. Any more question, guys? Okay. So, hindi pa man sabaw. Yes? Any questions?
Ang last regarding sa talk test. So, bali, like, for example, they'll walk ang patient in that train mo, continuous na or ask mo lang every once in a while and check mo kung gahapo-hapo.
Oo, yes. Samtang exercise shop, di ba, usually, kung nagpa-exercise kita kay patient, kapamangkot ka no nga, okay pa sir, di kung kaya niya mag-answer sa imo without being breathless, meaning okay pa si patient. But if medyo breathless na siya, or though it really, though nabulayan gid siya nabulayan gid siya magsabat sa imo, with exercising, along with exercising, meaning, heavy gid siguro ang activity para sa iya. Okay, so amo na siyang purpose ang talk test mo. So was that clear?
Yes.
Okay, sige. So let's proceed with the second half of our class. So i-record ko lang. For the second half of our class, so phase 2 outpatient, and then after that we're going to talk about your peripheral vascular system conditions rehabilitation. So okay. So for outpatient phase 2, so naka-discharge na-discharge na si patient. So your patient will undergo exercise tolerance test again at 4 to 6 weeks after myocardial injury niya. So if let's say for example, pagkuha niya isang ETT liwat, negative siya. So your exercise prescription would be 70 to 85% ang target heart rate. Or if you want na hindi magulpihan si patient, you can introduce 65 to 80% lang danay. So, start at the lowest, no 65 lang anay. So, para hindi gulpiada ang ni patient, no hindi siya mamag-o, or if ang iya nga healed wound, hindi siya bala mag-open. Okay? And let's say, for example, pag ETT, no, there is still ischemia present, nag-positive paghapon si patient for ETT. So the maximal oxygen uptake of the patient should be kept below of the ischemic threshold by computing the rate pressure product. So how do you compute the rate pressure product? So you compute this by, getting the heart rate of the patient, so resting heart rate, times the systolic blood pressure. So let's say, for example, si patient, meron siyang resting heart rate of 60. Okay? Times, ang iya systolic blood pressure is 110. So you multiply that, pila makuha mo? Wait. So, 2 ka 0, 0, 0. Okay, and i-ano to na lang. I-calculator. 60 times 110 is, 6,610. Okay? So, usually, ang ceiling, no, sang rate pressure product is, I think, 100 ang iya nga heart rate times 140 nga systolic blood pressure. That is the ceiling. Okay, so do maximum na siya. Wherein makahambal ka nga, na siya, do na maximum niya na, no. So that's 100 times 140, that's 14,000. Okay, so as much as possible, dapat lower than 14,000 ang rate pressure product ni patient. Okay, if ma-exercise ka gid man with ETT. Okay. Okay, so next, so outpatient na si patient, no? So, pwede na kita ka-introduce ang strength training. So, usually we begin with elastic bands. So, if you can still remember, aton nga mga TheraBands, usually mga nipis lang ang danay, no? We start with the light, and then light hand weights, mga free weights, mga dumbbells. Usually we use 1 to 3 pounds, and we introduce it for 12 to 15 repetitions. Pwede mo siya tungaon. Let's say, for example, for 12 repetitions, pwede nga 6 reps anay, and then rest, and then 6 reps again. Para hindi, kay patient, hindi siya gulpiada. Pwede man na, when you progress, pwede ka naka-progress to 10 reps, and then rest, and then 10 reps again. Okay? So, your patient should have at least 3 weeks cardiac rehab. So, dapat before ka mag-start no, sa strength training mo, naka 3 weeks cardiac rehab ka. So, naka-build ka na sa cardiovascular endurance kay patient. Kumbaga, balaan mo na ang mga triggers ni patient, if symptomatic siya, if asymptomatic. Okay? And then,